Welcome back to West Texas View.
As always, we're just cramming in so much information in our programs with Dr. Jain. I'm going to ask him to come back next Sunday also, because we're barely denting some of the things that were just really things that we needed to talk about. But before we get into obesity, I want us to talk a little bit about Texas Tech Health Science Centers and some of the things that they do to make our medical community so strong.
Right. Texas Tech Health Science Center Permian Basin is now expanding, and with our new leadership, with our new dean he's now about 2 years in the program. He has made so many different changes, Dr. Ventolini, that we are expanding in all areas. Department of Psychiatry particularly has now acquired a new building. We are moving to a new building which will be just Department of Psychiatry. We actively try to recruit at least one, or preferably two more psychiatrists. We should be getting sometime this year. So we have expanded in areas and offering a number of services. We have 2 PhD counselors available, along with 1 social worker at present. We have a number of groups available which are free to participants. There are depression groups for adults. We are planning to go into people who have been recently diagnosed with cancer. So we provide support for the people who have how to deal with cancer situations. And most importantly, we have a group for adolescents who cut themselves, who self-mutilate themselves, and seems to have a major psychiatric problems. All these groups are free for it. It's Midland. You have our telephone number to contact. Please do use the telephone to contact if you have anybody available. We also provide a monthly, what we call mental munchies. We often talk about topic of public health interest.
Much what we're doing here.
Much what we're doing over here, and these are all open to public without any charge, any fee or anything whatsoever. We tend to give out. You have my email address. So if you have any questions, please send us the email about it. We can also send you the booklet or the information flyer when these talks are going to happen and what topics are going to be happening. We have talked about postpartum depression, which is coming up. We also have talked about anxiety problems, interpretation of dreams, for example, what dreams say about. Talked about ADHD, talked about suicide. Things that most people deal with either with themselves or someone close to. So we are trying to, and also we have also started a very aggressive form of treatment. We call it electric shock treatment, which we have started in Midland Memorial Hospital for the extreme. It's called ECT, electroconvulsive therapy, which we have started for people where medications have not been helpful, and this kind of treatment can be life-saving. And I must underline the fact that it's not what popular media or Hollywood tends to pertain these kind of treatments. These are much more humane, much more effective. And
it's not the old-fashioned view of shock treatment.
It's not what is portrayed in One Flew Over the Cuckoo's Nest. And those kind of movies. It has become much more sophisticated. The technology has come up a long way in addressing those issues. And some of these treatments can be extremely life-saving, and a lot of people owe their lives to having these kind of treatments when medication obviously have not been effective at all.
And one of the things though that you mentioned is the munchies. I'm assuming this is like brown bag lunches, and you come and...
Yes, no, we provide lunch also. We provide lunch, so you just have to come and show up.
Okay.
So we provide lunch, and it's a kind of, originally we were designing this to help educate our folks at Texas Tech, but because it became so popular, we've been outreaching the community also. The level of information is given for everybody. It's not scientific, it's not jargon, it's no scientific mumbo jumbo. It's something practical information what people can
very
use.
Very clear language.
Very clear, very subtle, very down to the earth information that people can listen and learn and utilize in their daily lives. Those are the information I think going to be extremely important. And I would encourage you guys to do. We do both at Odessa, at the Texas Tech auditorium, but we also do in Midland at the Midland Memorial Hospitals. We have schedule coming up. I think there's the next week we're going to be talking about is postpartum depression, which is very close to home to us and to most families, and talk about what entitles what constitutes postpartum depression compared to postpartum blues, which most mothers have after childbirth. And the most dreaded component of postpartum spectrum or condition is called postpartum psychosis, where somehow there have been some fatalities. The most famous one was Andrea Yates' case in Houston about 10 years ago, in which a number of unfortunate events happened. So, we are entitled, we are moving forward towards in training new minds, training young minds towards medical students, encouraging them to whatever specialty they would like to to pursue further. But we also trying to reach out public and the masses in general to provide psychiatric help and care to as many people as we can.
And what a lot of people don't realize about the Texas Tech University Health Science Center is it is a medical school to train doctors, but it's also a continuing education facility to keep doctors abreast on all the newest things.
Right.
And it is has a full range of allied health like nurses and physical therapists and so on. But also they don't understand that this is a network. The flagship position is in Midland, but we've got a pharmacy school in Amarillo, we've got a pharmacy new school and nursing
school is here, and the physician assistant program, which is in Midland.
And
so
and the Midland has the Laura Bush Clinic that is really involved in all of the women's health issues. And then, of course, we've got El Paso. So it's a huge network.
Yeah.
And then how does the practicing physician, I'm afraid we're going to run out of time, but I want us to talk about, then you also have time for your own clients.
Right. So, because in Texas Tech, the philosophy is providing patient services, and our salaries, we are salary bound, we are state employees, and it comes from your tax dollars. So we have an obligation, it's in our mission and our goal to provide services, medical and psychiatric services. And with the services, we have incorporated trained medical students. So our first goal is to provide services, medical help, psychiatric help to folks. We also provide training to medical students to become doctors, and also residents to become licensed clinicians.
We just talk as fast as we can, and we still can't get all of this in. But next Sunday, we're going to start with this. We'll see you then, and thank you so much for joining us today, and thanks to Dr. Jain for giving us all this good information.
Thanks for joining us for News West 9's West Texas View with Johnny Lou Avery. This has been a public affairs presentation of KWAB-TV and KWES-TV.